Hi, this is JC, and today's report is brought to you by Hyperhidrosis and Miliaria Rubra. Have you ever come across someone that was just spreading so profusely and you're like, ew? Well, turns out they may not be able to help it. Their body could literally be holding them in a sweat prison called hyperhidrosis. They can be in the comfort of an air-conditioned room, just lounging, not doing a lick of exercise, then bam! The sweating starts. They can perspire so much that it can drip off their hands or soak completely through their clothes. And this chronic excessive perspiration could stem anywhere from medication and stress to genetics. Actually, close to 5% of Americans suffer from it. There are two types of hyperhidrosis, primary focal and secondary. Now, secondary hyperhidrosis is the less common of the two. They can have heavy sweating all over their body, all due to side effects of certain medications or a medical condition. A few are diabetes, menopause, thyroid problems, low blood sugar, some types of cancer, heart attack, nervous system disorders, infections, adrenal gland disorders, even things like opioid withdrawal or antidepressant medications can cause it. Literally, the list can go on. Now, on the other hand, primary focal hyperhidrosis is the more common of the two. No medical cause for it. They say it can all be chalked up to your DNA. Yep, that's right, it's hereditary. And this one usually affects your feet, hands, head, underarms, and sometimes your face. So, how do you know if it's just your average run-of-the-mill sweating or abnormal excessive sweating? Well, there's a few things you can look out for. If you've had excessive sweating that's occurred for at least 6 months for no apparent reason, sweating that occurs on both sides of your body in roughly the same amount, incidents of excessive sweating at least once a week, and sweating that interferes with your daily activities like work or relationships. Excessive sweating that began when you were younger than 25, not sweating in your sleep, and lastly, a family history of hyperhidrosis. If you checked any of those boxes, you might want to talk to your doctor. Since it is a genetics thing, it could run in your family. So, if you have a sweaty aunt or uncle and you're like, gross, have a little sympathy. That could be what your future kid has to go through. But don't worry, there are treatments that can help. If you want to go the home remedy route, you can try an aluminum-based antiperspirant, make sure you're bathing daily, or wear clothing made of natural materials that allow the skin to breathe. And if those just don't cut it for you, just make an appointment with your doctor to get checked out. You may find that all you need is a prescription-strength antiperspirant or maybe a prescription cream that can help with your face and neck sweating. But for some, those can irritate their skin. If those don't work, the doc may have you try some oral meds that are known to help, like the nerve-blocking kind or antidepressants. Even though there are some antidepressants that can cause secondary hyperhidrosis, there's some that are actually used for depression that can decrease sweating as well as lower anxiety that worsens the hyperhidrosis. And then there's the nerve blocking meds. What these do is basically block the chemical that allows certain nerves to talk to each other, reducing the sweat in some people. But it can have some crazy side effects like bladder problems, dry mouth, and even blurred vision. And you know Botox? Yeah, the kind that a lot of people use to smooth out the wrinkles. It works to help stop sweating too. They just inject the areas of your body that are affected, and you're good to go for about 6 to 12 months. Well, for some, it can be a little painful, and then they might even experience temporary muscle weakness in the treated areas. And if none of these work, there are more extreme treatments like microwave therapy. They use a device to deliver microwave energy to destroy the sweat gland. It can be pretty effective, but it can also be pretty pricey, and as well as give you some discomfort and change your skin sensation. Then another treatment is sweat gland removal. If the excessive sweating is in your armpits, they can actually remove the sweat gland with a technique called suction curettage. And the very last option would be nerve surgery or a sympathectomy. The doctor would perform a surgery to either intercept the nerves without removing the sympathetic nerve, or actually cut, burn, or cut the spinal nerve that controls sweating in your hand. So it's not really an option if the sweating is just on your head and neck. And in some cases, this procedure could backfire and cause excessive sweating in other parts of your body. I know, it's a lot. And folks that have this disorder often suffer from social and emotional effects of it all. Their condition could affect normal daily activity and be a huge source of embarrassment and social anxiety. I mean, can you imagine going into a job interview or a first date? I mean, that can already be nerve-wracking. And then on top of that, to start sweating profusely. And to top it off, those emotional side effects are not the only side effects. They're also more prone to skin infections, which makes this next star player act up even more. Miliaria rubra. What is that you say? Well, not to be mistaken with malaria, Miliaria rubra, also known as prickly heat, is just plain old heat rash. It's a rash of small red bumps and itchiness caused by the blockage of the sweat glands, specifically the sweat ducts deeper in the epidermis. And it's more common to show up on the neck, shoulder, chest, and skin folds like the armpits, elbow creases, and groin. But you can get all over. And anytime your body overheats, you're more susceptible to it. It's actually pretty common in newborns since they don't develop sweat ducts yet and are more likely to be overbundled. But adults can get it too. Actually, anyone can get it. About 4.5% of newborns get it, and about 30% of all ages get it. So how do you get it? If you're in a tropical climate, hot, humid, kind of like Hawaii, you can get it. If you're dressed warmly or have synthetic clothing on your skin, you can get it. Sleeping under heavy blankets or electric blankets, you can get it. If you have prolonged bed rest, sometimes they make pregnant women that go on bed rest for a while, you can get it. If you're doing intensive exercise, you can get it. If you're running a fever, you can get it. Trust me, I know firsthand. That, my friends, is an actual picture of my skin. Anytime I run a marathon or fever, that is all over my body. I'm literally looking like an itchy lobster for a good 3 to 4 days. But luckily, treatment is pretty simple. The best prevention and treatment is staying cool. So if you think you're starting to get that prickly heat rash or already have it, start shedding those clothes. No need to get naked. Just slip into something loose, breathable, and not constricting. If it's a fever bringing it on, pop some Tylenol or ibuprofen to get that fever down. If it's hot out, try to stay in a cool place. Keep a fan handy and beeline to an air-conditioned room if you can. Or maybe throw on a cold compress. Do what you can to reduce sweating and avoid anything that can irritate your skin. Don't worry, it could all go away in as little as a couple days, and at max, a few weeks. Well, that's a wrap. I hope you learned a thing or two about hyperhidrosis and Miliaria rubra. Thanks for tuning in and stay cool, my friends. Have a good day. JC out.